Massachusetts General Hospital Orthopaedic Surgery provides expert treatment for hip arthritis, including simple and complex joint replacements. The program's joint replacement surgeons have more than 160 years of combined surgical experience and perform over 800 hip replacement surgeries each year. At Mass General, patients have access to the latest approaches for hip replacement, including a variety of minimally invasive techniques and new materials. At Mass General, hip replacement surgery has a high success rate and a low risk of complications. 98% of first-time hip replacements are successful, with 2% of patients requiring revision surgery to improve results within 1 year of their initial operation. 94% of patients recover without any need for readmission to the hospital within 90 days of surgery. Patients undergoing hip replacement surgery at Mass General have a smooth recovery, and nearly half go home the same day or the day after surgery. Mass General surgeons track patients' recovery and rehabilitation from hip replacement surgery to ensure the best possible outcome. Prior to surgery, patients are asked to self-report hip pain and function symptoms on a scale of 0 to 100, with 0 representing extreme hip problems and 100 representing no hip problems. Patients are surveyed again after surgery to measure improvement. Patients experience improved hip pain and function after undergoing hip replacement surgery at Mass General. On average, patients report a 19-point improvement 3 months after surgery and a 27-point improvement 12 months after surgery. Visit massgeneral.org/compass and click the links below HIP to learn more.